So vascular disease is a pathology pertaining to blood vessels, and it includes disease in your arteries in your blood vessel that go to brain, that could give you stroke if there is a blockage, disease in your heart vessels, disease in your main artery that comes out of your heart, which could balloon up and rupture and could lead to a fatal outcome. And most common we see is disease in your vessels in the leg, where you are developing blockages, and as you walk it causes you pain, sometimes wounds on the feet that could require endovascular surgery or sometimes bypasses, and if not treated it could lead to limb loss. So vascular and endovascular surgery are both operations you do on blood vessels for different diseases like blockages, inflammation, sometimes various kind of pathologies. And they both are same thing. Vascular, it essentially means when we do open surgery where we have to make an incision, go down to the artery and fix it. Endovascular achieves most of the same things, but you do it through a catheter where you put a small needle inside the artery and you fix everything from inside instead of going it from outside. To become a vascular surgeon, it requires medical school. After that, you have to go for 5 or 6 years of general surgery training. And after that, you go for 2 more years of vascular surgery training, which focuses training on blood vessels, operation, open surgery, as well as endovascular surgery. So in total, it takes about 8 years of general surgery plus 4 or 5 years of medical school to become a vascular surgeon. So vascular disease is diagnosed with different modalities being non-invasive as well as invasive technologies. We start always with non-invasive technology, which could be as simple as taking blood pressure in different arms and finding a difference. There is an ultrasound which can actually look inside your blood vessel with a probe and tell us if the blood is flowing, if there is a blockage in the blood vessel. And then on the invasive side, sometimes we have to put a needle inside the artery and inject some special dye which lets us see under X-ray, and then that can show us if there is a blockage or if there is a specific problem with the blood vessel that we need to intervene upon. Peripheral vascular disease is one of the most common diseases we see in vascular population, where they develop blockages in their leg vessels leading to wounds on their feet and sometimes to limb loss. And to treat that, we could do endovascular angiogram and open up the blockage from inside the vessels, and sometimes the blockage is so bad that is not an option, and in that case we have to do a surgical bypass where we bypass the blockage from open segment to open segment using your own vein and sometimes a prosthetic graft, depending on how suitable your vein is. Carotid Antarctomy is a procedure that's done to remove the blockages from carotid artery that could lead to stroke or permanent disability. In that procedure, we make an incision right on the artery, on the neck, depending on the side. We go down to the artery, free it from surrounding tissue, open the artery up, remove the blockage, and then close the artery up either directly, sometimes using a bovine pericardium as a patch. Here at LVI, what we have is we have a team of multidisciplinary experts, including interventional radiologists, minimally invasive surgeons, and open surgeons as well. So we combine our efforts to provide as many options as we can in order to avoid the amputation, or at the least delay it for a year, 2 years, or 5 years, depending on how salvageable the situation is. Most of the reactions I get from my patients when I see them after surgery is they are very happy to go back to their life. They can live their life normally. They are running, they are walking, and they are doing everything they wish to do without being restricted by this peripheral vascular disease.